aspirin. You've probably got some in your house right now, right? For, I don't know, 100 years, it's been the go-to for headaches, aches and pains, heart health, you name it. But what if this super common everyday pill has a secret identity? A totally surprising second act in one of the biggest fights we faced in modern medicine. Let's dig into the science because it's pretty incredible.
I mean, that's the big question, isn't it? And it's one that scientists are taking very seriously. The whole idea that a cheap, easy-to-get drug could have a real role to play here, well, that's nothing short of revolutionary. So could it be true? The answer, as you're about to see, is way more complex and, honestly, more fascinating than you'd think.
So here's what we're going to do. We're going to break down the latest evidence. We'll look at what these massive studies are telling us about aspirin's role after a cancer diagnosis. Then we'll get into the tricky topic of prevention and, of course, the very real risks. Just to be super clear, this is all about understanding the science. This is not, and I repeat, not medical advice. Okay, first up, let's talk about where the evidence is the strongest. And that's using aspirin after someone has already been diagnosed with cancer. This is where things get really, really interesting. 20%. Just look at that number. It's a big deal. A huge meta-analysis, that's where scientists pool the data from a whole bunch of different studies to get a clearer picture, found that cancer patients who took aspirin had around a 20% lower risk of dying from their cancer. A 20% drop. That's a huge signal that made the entire research community sit up and pay attention.
Now, this part is absolutely crucial to understand. We are not talking about aspirin as a cure or as a replacement for anything. We're talking about it as an adjuvant therapy. Think of it like this. Chemotherapy or immunotherapy, those are the superheroes. Aspirin is the trusty sidekick, coming in to help the main treatments work even better.
And this effect seems to change depending on the type of cancer. So let's look at this table. See that HR column? That stands for hazard ratio. All you need to know is any number below 1.0 is good news. It means a reduced risk. So for colorectal cancer, aspirin users had a hazard ratio of 0.72. That's about a 28% lower risk of mortality. For breast cancer, it's even lower. And for prostate cancer, about a 13% lower risk. These are not small numbers. But the story doesn't stop with those big three. It gets even more compelling. We're seeing some really promising results in some tough-to-treat cancers like gliomas and melanoma. And then there's this. Some studies suggest aspirin might cut down on metastatic spread by up to 35%. That is a potential game changer, because when cancer spreads or metastasizes, that's what makes it so deadly. Okay, so this all sounds incredibly promising, but it leads to the obvious next question. How, right? How on earth could a simple painkiller be doing all of this? Well, scientists think it comes down to a couple of really clever mechanisms.
But before we dive into the how, let's just make sure we're all on the same page with this word, metastasis. It's a clinical term, but it's simple. Metastasis is when cancer spreads. It's how a tumor in one spot can become a disease throughout the entire body, and it's the thing we are most desperate to stop.
All right, this is so cool. One of the leading theories is that aspirin basically blows cancer's cover. See, cancer cells that are traveling through your bloodstream are pretty clever. They can grab onto tiny blood cells called platelets and use them to form a kind of shield, a cloak, that makes them invisible to your immune system. But what does aspirin do? It's famous for making platelets less sticky. So it basically yanks that cloak off, exposing the cancer cells so your body's own T cells can finally see them and attack. It's brilliant.
And that's not all. There's another thing aspirin is famous for: fighting inflammation. It works by blocking these things called COX enzymes. Why does that matter? Well, we now know that chronic inflammation is like pouring fertilizer on many types of cancer. It helps them grow, spread, and thrive. So, by tamping down that inflammation, aspirin might be taking away one of cancer's favorite tools.
So if aspirin can help treat cancer, then the next logical question is, can it help prevent it from showing up in the first place? Well, this is where the story gets way more complicated. And the answer really seems to be, it completely depends on who you are.
And for prevention, this slide is really the whole story. A huge UK study that came out in 2024 found a massive difference between two groups of people. On one side, you have patients who already have a chronic inflammatory disease. Think rheumatoid arthritis or diabetes. For them, taking aspirin was linked to a significant drop in risk for 9 major cancers. But on the other side, otherwise healthy people, there was no overall benefit found. In fact, some data even hinted at a slightly higher risk for certain cancers. A totally different story.
So let's just zero in on that first group for a second, the people already dealing with chronic inflammation. For them, the protective effects seem pretty widespread, covering a whole list of cancers like breast, colorectal, kidney, you name it. And get this, the study also found that if those people were also taking statins, the protection got even stronger, extending to even more cancers like liver and bladder.
Okay, all of these potential benefits are, obviously incredibly exciting. But, and this is a really big but, before anyone even thinks about reaching for the aspirin bottle, we have to talk about the other side of the equation, the risks and the reality.
Which brings us to the question that is probably on your mind right now. With all this potential, why not just start taking a low-dose aspirin every day, just in case? The answer from pretty much the entire medical and scientific community is a very loud, very clear no.
You have to remember, aspirin is a powerful drug. It's not a vitamin. Its biggest and most well-known risk is that it can cause serious internal bleeding, especially in the stomach, and that risk goes up as we get older. On top of that, its side effects can get worse when you're taking it with other powerful treatments. And maybe most importantly, this science is still unfolding. There are literally over 30 clinical trials happening right now to figure all this out. We don't have all the answers yet.
And I think this quote from one of the big research papers says it all really. The adequate informing of patients of the benefits and the harm is difficult, but it is important that shared decision-making is not compromised. What they're saying is, the whole point of this research isn't to create some new rule for everyone. It's to give doctors and patients better information so they can make the best decision together.
And that right there is what this all comes down to. This is the single most important takeaway. Everything we've talked about today is the start of a conversation, not the final word. The only person who can help you weigh the potential benefits against the very real risks for you, your body, and your health is your doctor, period.
And as we wrap up, it does leave you with a pretty wild thought, doesn't it? Aspirin has been sitting in our medicine cabinets forever. If it's been holding on to these kinds of secrets all this time, it just makes you wonder what other common, cheap drugs on the pharmacy shelf are just waiting for us to discover their incredible second acts. The answer to that could change medicine all over again.